when we're looking at the functions of the nervous system, one of the key principles is understanding that the nervous system is composed of layers and levels. When we look at the importance of that in terms of someone's function and the function of their nervous system and how they live their lives, we know very, very clearly that the deeper areas of the nervous system are older and they're more deeply ingrained. And they're actually, the activation of those pathways is very, very clearly linked to evolution itself. Okay. And one of the main drivers of evolution or the development of our nervous system is how our body responds to gravity. So if we're fish and just floating around in the water, nothing really changes. So fish have stayed the same for millions and millions of years because they haven't tried to do anything different. Okay. But as soon as some version of fish tried to climb out of the water, it started to encounter more effect of gravity on its body, and its body had to respond to that gravity. It had to sort of fight against it. And it may not have had the capacities to do that for very long, but as each evolution of that creature happened, it created more and more capacity to resist gravity, to lift its head up or to push itself, push its belly off the ground. Okay. So you have things like salamanders or even like snakes first, and then you have salamanders and things that kind of lift their belly up and run along, and then they sit back down again. They don't have the ability to extend for very long. Then you have the development, but what's happening is there's new areas of the brain that allow them to do that, to have limbs, to be able to control these limbs in such a way. And then as each sort of layer of evolution happened, we created more and more capacity for extension. Okay. So the two things are very closely linked. It's actually gravity's effect on us that's creating more activation of neurons, that's actually creating more voltage into the central nervous system and into the brain of these creatures, that is basically driving, literally just pumping electricity into this primitive system. But as that primitive system tries to extend and extend and extend, it actually helps to promote its own evolution. So evolution is very closely linked or very dependent on, in fact, gravity. And our brain is still linked very strongly to gravity. So as we grow up, we're born, and we start to go through our first year of development, we start to have the greater and greater capacity to resist gravity, to stand upright. Okay? And it's one of the most enlivening things as a parent to see your kid being able to stand up and walk. As each stage happens, you're like, wow, you're this evolved creature, and your capacities are moving into these areas of brain that are already, the potential is there, but now the potential is realized because you're trying more. Okay, you're trying to extend yourself more. And we can follow this chain of thought to higher and higher states of consciousness as well. So who we are and where we evolve to is still related to gravity. You have to be able to move around and resist gravity to really fully potentiate your brain. If your brain is fully potentiated, then it can do its next stage of whatever evolution is. So it sort of starts to beg a question of, philosophically, of what's the next stage of evolution of humans. We don't know. But in order to really reach that, we have to be healthy creatures and capable of withstanding the effects of gravity. And not only that, to be able to dance in this field of gravity. Okay, so anyway, that's where evolution has its effect on our nervous system. Those gravity-dependent receptors, those receptors that are sensing gravity, are what we call tonic receptors. They're always firing. They're constantly firing. And the quality of that information is saying where gravity is from and how strong the effect of gravity is on me right now. Okay? So gravity is effectively 1G. Okay? If you sort of go up in a rocket ship, you'll have more G's pulling down on you. But effectively, there's subtle variations of gravity that are happening as we're moving about. Okay? You're in the car and you accelerate. Now you have the effect of gravity pulling straight down, but also the perceived gravity as you're accelerating in a straight line. Okay? So that acceleration, that pull, is perceived as gravity. So our body is modifying our control of our body and how we stand in accordance to those those two gravity vectors, if you will. Okay, so if you're accelerating in one direction, you have a gravity vector, which will be pulling you straight back that way. Okay, but you also have gravity pulling you down. And the sum of those is going to pull you in a direction, which is going to be exactly represented by how you lean when you're in the train. If the train is sort of accelerating this way and you sort of lean to the side, you're actually countering the gravity pulling you this way and the gravity pulling you down. Okay, so it gets into sort of complex maths when you start looking at the effects of these pulls on us. Okay, but as long as you have that sort of linear acceleration like that, it feels like a gravity. Okay, but that's still being perceived by our gravity receptors. Okay, when we perceive other types of motion, like phasic receptors, we're sensing accelerations that happen about an axis, okay, or translational accelerations. Okay, so but that has to be in relation of one part of our body to another. If our whole body's accelerating, it feels like gravity. If it's one part in relation to another, it's more of a phasic control of sensing accelerations. Okay, so we have tonic systems that are sensing gravity and load and constantly feeding information into our brain. That's important because it is a constant source of electricity for our brain. And we know that if we don't use it, we lose it. That old concept of use it or lose it, your brain's going to fall apart if you don't use it. But then, well, wait a minute, what happens when you're sleeping? What happens when you're not thinking? Okay. How come all the cells in your brain, if I haven't thought about a certain thought for a while in a certain area of my brain, how come that part of the brain didn't die? And the reason is because every area of our brain gets activated with like a little trickle charge. Okay. Every area of your brain is being activated with a little trickle charge all the time, just to keep all those cells alive. Where does that energy come from? From these pathways, that are derived from tonic receptors. So in other words, it gives health and activation to cells, not enough that they start to fire off. That would be like an epileptic fit, right? But enough that it keeps those cells alive and active. It's a trickle charger. Yep.
Is that the reticular formation?
Yep, exactly. So reticular activating system.
And like every vertebrate's going to have that, like, same system.
So the reticular formation is a group of neurons in our brain stem, which is more closely linked to kind of autonomic function. The reticular activating system is something different. It's more about how when you have that afferentation coming in, what it's doing to the rest of your brain. So reticular activating system, we often consider linked to your awareness level. Okay, and your awareness level is linked to how much voltage you're getting into your system and how capable that is of potentiating your brain. Okay, so it's like you kind of switch on all the circuits. Okay, that's what the reticular activating system does. Puts a certain voltage in the system. So you might be operating at 220 volts, but your taxi driver this morning may have been operating at 50 volts. You don't know. Okay, so some people are kind of a little bit more alert and some people a little bit less. Okay, and that's dependent on your reticular activating system. So some of that is externally driven. Okay, and some of it's internally driven as well. Like you can actually just hype yourself up too, right? So the point being is that our tonic system is providing that source of electricity. So again, gravity is activating our tonic system. Tonic system is activating the reticular activating system and activating the whole of our brain in like a trickle charging way. And you can have a big trickle charge or a little trickle charge, but it should be keeping most of those brain cells alive and healthy. Once we have any compromise to that system, so a subluxation, something that's creating a deafferentation, it's going to, oops, I forgot to turn the order on. Once we have something that's going to affect that, whereby we're getting less activation, so every subluxation is going to be taking away some of that voltage. So in other words, if all of your joints are functioning perfectly well and your system is healthy, okay, you have good metabolic function, you should be getting a certain amount of activation of your brain. Okay? Every subluxation is going to be characterized by a deafferentation. Why? Because when your joints are functioning normally, you should be able to maintain a closed back position. So I'm sort of demonstrating relatively closed back position here. My joints should be getting pretty close to maximal stimulation, okay, from those tonic receptors. You don't have to move. Just standing there, gravity acting on me is creating electricity in my system. Okay, that's all I need. We usually think about activating our brain by moving, but these tonic receptors don't need movement. They just need to feel the load of gravity accurately. Okay, if our joints are in the closed pack position, we're getting maximal stimulation because we have maximal approximation of the joint surfaces. So the biggest parts of the joints are touching each other, okay? And you have the greatest concentration of receptors in that closed pack position, which means you have greatest potential for augmentation. Yeah.
Based on that being a kind of safe, space or kind of position to be in, why do we not test more than in an open pack position where there's less affrontation and less kind of feedback into the system to try and draw out more anomalies, if you like?
So why don't we test in an open pack position versus a closed pack
Especially
position?
if it's like, say, a cyclist who's doing time trialing or something, they put their head down, but they're very much in an open pack position, or a rower, say, who's coming forward.
Exactly. It's a very good question, and I'm glad you asked, and we're going to be answering that more today. I did touch on it a little bit yesterday, but remember how we were saying we put someone into the P1, into the left anterior position?
Yeah.
We're actually going into the positions where people have function or failure.
Okay.
So when systems break down, it's a little bit of a diversion, but I'll answer that now. Just quickly, is that when people have a failure in their nervous system, it will be represented by something externally. And sometimes you'll have almost like a little bit of a blind spot. Like you think of what a blind spot is. The thing a blind spot is it's an area of space that you just can't see things. Okay? Now there's an anatomic blind spot and a physiologic blind spot. So what happens is if your brain's awareness drops, just tied into what we're talking about, those receptors in that area don't perceive what you're seeing. So the way that works, let me just go through it. The way it works is you have concentrations of receptors in your retina, okay? The greatest concentration in the macula. It's just straight ahead vision. But as you start to move away from that, okay, so things that are in your lateral field or in the medial part of your retina, there's fewer and fewer receptors. So it's actually harder to see things out here than it is if things that are right in front of you. We all know that, okay? Your peripheral vision. But the capacity to perceive what's happening peripherally, especially in this area around where your anatomic blind spot is very dependent on your reticular activating system activating your brain enough that it can take that small amount of stimulus and have perception. If the trickle chargers have dropped away, we don't have the greatest potentiation of our brain, okay? And what happens is those receptors, where there's very few receptors, they don't get perceived. You just don't see it, okay? So you have a blind spot. You can move things around in there, and the person's looking, and they're like, no, I don't see it. I don't see it. And you're like, that's a pretty big blind spot, okay? That's why when you're driving down the road, the tree jumped out in front of you, okay? And you hit it, okay? It didn't jump out in front of you. That's the secret, okay? Is you just didn't see it. You didn't see it until it was right in front of you, okay? That's what a blind spot is. That's the joke, is that the tree didn't jump out in front of you. You just have such a big blind spot that it had to actually appear right in front of you before you could see it, okay? So it's exactly the same thing we're talking about right now, is that reticular activating system and activation and potentiation of our brain is very, very dependent on tonic receptor activation, primarily from joints, okay? There's a lot that comes from your vestibular system, but there's also a huge amount that comes from our joints. Which joints more than other joints? Higher joints, because there's more receptors in them, okay? And also, but basically your neck, okay? So the neck is super important. So people that are like neck specialists, great, fantastic. You probably get great results because you're going to be able to fix all kinds of things. If you're able to do that well and potentiate the brain, then you're going to be able to have much greater brain function and see bigger improvements more quickly, okay? So the tonic system, it's really, really important to break down our understanding of the nervous system in terms of the tonic and phasic systems, okay? So by tonic and phasic system, we mean systems. We mean sensory, integrative, and motor systems. Sensory, integrative, and motor systems. So the tonic system, as we said, has receptors that are in our inner ear, the otolith, okay? So that's our utricle and saccule. They're constantly being activated by the load of gravity, telling us where our head is in relation to gravity, okay? We have the Golgi tendon organs in the muscles that are the load sensors in the muscles. Even our muscle spindles, I don't talk about muscle spindles that much. I like people just to think of muscle spindles as stretch receptors and sensing motion. But we have two different types of muscle spindles: nuclear bag fibers, nuclear chain fibers. And nuclear chain fibers are actually tonic as well. So some of those muscle spindles are actually giving tonic information too. Okay. And then in the joints, we have Ruffini endings. So Ruffini endings are in the joint capsule, and they're giving tonic information about where that joint is positioned to the load on that joint, which is equilibrated to the effect of gravity on that joint. Okay? So we have all of this system, and all of that gets integrated in our vestibular nuclei, in our brainstem. And from the vestibular nuclei, it goes lots of different places. It goes to your cerebellum, it goes to your cortex to tell you where you are, and also goes reflexively straight back down to your spine to respond immediately to those perturbations, to those motions. So as soon as your body moves in relation to gravity, your body, all these sensors are sensing it very, very rapidly. They're always, and your body is going to go to the vestibular nuclei and fire back down through the medial vestibular nuclei, the vestibular spinal nuclei, to medial, through the vestibular nuclei to the vestibular nuclei, and through the medial vestibular spinal pathway back to the spine. Okay? It's easy. Vestibulospinal. Vestibular nuclei to the spine. Activates the spine. Okay? The other lateral vestibulospinal pathway fires more to more lateral, further away things. So lateral vestibulospinal fires to tonic muscles. Okay? They both fire to tonic muscles. Tonic in, tonic out. They fire to the tonic muscles that are all throughout our body. Remember, we said that in our extremities, all of our muscles in our extremities have both tonic and phasic muscle fibers. So in other words, they have both slow twitch and fast twitch muscle fibers. So those slow twitch muscle fibers are controlled by the lateral vestibulospinal pathway. Okay? Because they're there to offer postural support in relation to how our body is moving in relation to gravity. So when we're standing up straight, or we're doing whatever we're doing, any aspect of holding capacity we need in our muscles is controlled by those holding muscle fibers, those slow twitch fibers. So this whole network is operating all the time. You don't have to think about it, and it's very, very gravity sensitive. So when you lay down, or there's less effective gravity on your body, we should see all of those muscle fibers decrease in their not turn off completely, because there's still gravity. It needs to be able to hold the joints together. You don't want your spine falling apart when you sleep. For some people, it does. You roll over and you're like, oh, my neck, what happened? I was just laying down. Well, your tonic muscle system was so poorly functioning, that we see a breakdown and a failure of those muscles. Okay? So that's why the tonic system is important. So these holding muscles are in the spine. We call intrinsic muscles. They're very, very close to the midline. But not only do they create stability and respond to gravity, they're also very, very important for maintaining and managing the motion of joints. Because you don't just have a pivot point. I mean, you do on C1, C2, but it's like you don't really have pivot points on all of your vertebrae. It's pivoting because of the control of those muscles. So the accurate and precise control of those muscles is essential to good mechanics, biomechanics in your joints. Anything that compromises the balance of those muscles can compromise the stability of our joints. Okay? So I'm not sure what's buzzing over there. Hear that?
That's the AC unit.
Oh, it's AC. Okay, sorry. So this is very, very important. Okay? And we know that this system can become compromised. When someone has a trauma, traumas are forces that are beyond our capacity to resist. So any force beyond our capacity to resist could have an effect on our muscle to be able to contract. So like we talked about yesterday, we have a myotactic reflex, which is basically when a muscle gets stretched, it will contract in a graded response according to the degree of contraction. So a small tap, you get a small response. A bigger tap, you get a bigger response. And that goes all the way up until you get to the limit of the muscle. Once you reach the limit of that muscle, or the modulated limit of the system, we go into that more today, is your limit might be less. Sometimes someone just takes a step and then boom, their leg gives way because you're essentially your system is so suppressed that you don't have any holding capacity. Okay, so it's almost like you're hitting an inverse myotactic reflex faster. So I let the cat out of the bag. Yep, sorry, Kate.
The inverse myotactic reflex, is that also modulated as in a big
Yep.
failure will result in a longer, worse?
So there is a hard limit on when that should be, and you want that limit to be as far as possible, especially in athletes. What we need to do is we need to train them to be able to have an inverse myotactic reflex much later. Okay, but in order to do that, they have to have really incredible capacities.
But when it happens, it's failure.
Yeah, it'll
be a little bit of failure or a lot of failure depending on
the inverse myotactic reflex. They turn the muscle off.
Just gone.
They turn it off. Okay, but in athletes, what you're trying to do is if you have enough strength in the system, so in other words, their tonic system is super strong, their phasic system is super has a very high capacity for high load, and if those two systems are functioning very well, they're doing superhuman things, you know. But there's still going to be a physical limit. There's still going to be a point where they get hit hard enough where it's going to shut the system down. Okay, and that's when you see, you know, elite athletes break. You know, and I see this a lot. I treat some cool people, do some awesome things, people you know, you know, I've seen people with like more than a year of issues that goes like that, and then they're like, boom, back on the field doing incredible things. So you can turn things around really quickly, and that's the exciting part about this. And it's the exciting part of really what we're getting at here is we're trying to explain what is the miracle behind miracle cases. Like why do miracle cases happen? If we understand the system well enough, you can have miracle cases every day. You know, we do. I do. I see it every day. People that are using this can do it every day because we now have the capacity to understand how our nervous system works and how it responds to these stresses. But it really comes down to understanding, again, the easiest way to break that down. There's so much to learn, but I'm trying to make it as simple as possible by just breaking it down into simple components and knowing where we start. So if we really have a good sense of this tonic system, which is very important, it creates a baseline of function for the whole of our body, okay? Because like we said yesterday, those tonic receptors are telling you where you are in relation to gravity. And all that information is fed into your brain. It's a lot of information. So our brain actually has specific areas. The somatotopic maps are these huge areas of our brain that are just mapping out where every part of our body is all the time and where gravity is acting on those parts of the body. And the somatotopic maps are being fed not just by joint mechanoreceptors, but by muscles. Okay. And so all the sensors in the muscles, all the sensors in the joints are all feeding that area, okay? But particularly the tonic fibers are building those maps. So the tonic receptors are building the maps in our brain of our body. So if our body can't get into certain positions, those maps in those areas start to fail, and we create little holes in function, like blind spots. Exactly like the blind spot. The blind spot itself is representative of more of an integrative issue affecting your vision, okay? But you can have joint issues that are affecting other things as well, okay? So it's just a matter of where does it start from, right? So going back, so our tonic system is, again, creating the strength, controlling the joints and the joint function, but that system can be compromised by stresses, particularly by stresses that we call traumas. I define a trauma as a stress beyond our capacity to resist. So any stress that's beyond your capacity to resist, whether it's high or low, it's beyond your capacity to resist, it's going to be a trauma. And what happens to our joints during a trauma is particularly what's happening to the muscles. Okay, not necessarily the joint itself. Yes, there's going to be stresses to the joints, could be ligamentous stresses and so on, but it's what's happening to the muscles that's most important because that's what's holding the whole thing together. So when we have a normal stretch, we have a myotactic response. The muscle will contract. But if we have a force beyond our capacity, beyond the limit of that muscle, if we were trying to still use a myotactic response when the tree jumps out in front of you and you hit the tree, when that happens, if you have a myotactic response, you're going to rip the muscle. Our body knows that, and we are programmed with the blessing of the inverse myotactic reflex. Inverse myotactic reflex is the reflex that turns that muscle off to protect the muscle. It's better to let the joint take the stress than to tear the muscle. So imagine if you're out in the Sahara and you're being chased by a lion, and you trip and fall. If you fell and your muscles contracted and you ripped your muscles, you'd be lunched for the lion. Okay, it's better to let the joint take the suffering and have a muscle that can still function. Okay, so when we have this inverse myotactic reflex, what it does is, again, it makes the muscle switch off. It's a reflex that rather than making it switch on like the myotactic reflex, it makes it switch off. Now, the duration of effect of that inverse myotactic reflex is different in the two muscle types. So we have slow twitch and fast twitch muscles. Again, the slow twitch muscles are the ones that are good at holding, and we have fast twitch muscles are the ones that are good at accelerating us, explosive motions, all the things we use to move our bodies. Okay, those are phasically activated muscles. Okay, and they're fast twitch. When you have an inverse myotactic reflex that throws your head, say, all in one direction, which muscles are being stretched? All of them. Slow twitch, fast twitch. When you go to the end range of a joint, whether it's a trauma or a chiropractic adjustment, you're stretching all the muscle fibers. Slow twitch, fast twitch. In that trauma, what's going to happen is the fast twitch, all the muscles will be switched off by the inverse myotactic reflex. The fast twitch muscles will recover more quickly. They recover in minutes to hours. Okay, minutes to hours. So like you fall and you go, ooh, ow, oh gosh, oh, my arm feels dead, it feels weird. And you kind of move around for a few minutes and you're like, yeah, I'm better. And an hour later, yeah, maybe I'm fine. Or maybe the next day you feel okay again. But that same trauma is going to have, if it has a stretch on the slow twitch muscle fibers as well, which if it's at the end range, it will, is going to have a lasting effect that will last for weeks or months. Weeks or months. It's what the textbooks tell us. I'm not making it up. Weeks or months. So it means for the next weeks or months, those slow twitch muscle fibers have a lesser capacity to contract. And in that time, that's when the sort of bad news happens, because if you have a trauma that drives one joint in one direction, those muscles that get stretched, the intrinsic muscles, are not going to be able to contract. And as we know, anytime any muscle contracts, it will inhibit its antagonist. This is very important. It's very important to have this control where every muscle is being contracted and being inhibited, then it goes the other way and contracts and inhibited the other way. Okay? But if you don't have the ability to contract a muscle, you don't have the ability to inhibit its antagonist. So what will happen is post-trauma, one muscle is less capable of contracting. The antagonist will start to contract more because it's not being inhibited. It's always a degree of activation. And anytime you're tilting in one direction, you're going to activate that muscle, but it's going to activate more and more and more because it's not being inhibited. There's nothing keeping it in check. So what we'll find is that's what keeps those joints subluxated. Okay, so the subluxation itself is due to this effect. Okay, when we have this persistence of time, persistence of the weakening of that muscle, or the change in reactivity, or the decrease in the gain of that muscle, it can't inhibit its antagonist, and boom, you got a subluxation that's stuck there. And then all of chiropractic has been trying to find ways of trying to resolve that. The way that we're doing this with adjusting to neutral is we're just looking at that antagonist to the traumatized muscle and going, well, wait a minute, you're too tight. All that you're doing is keeping the joint from coming back to neutral. Okay, so if we can find the exact position that that joint is most stuck in, if you will, and drive that joint back to neutral, okay, with a translational drive, we can very effectively create a stretch just on that intrinsic muscle in just that vector and resolve its tension. And if we can, remember, when we're doing a fast stretch on a slow twitch muscle, okay, that's it, we're going to elicit the inverse myotactic reflex, and that has what kind of duration on a slow twitch muscle?
Weeks to
a long duration, right? So that type of adjustment will have a lasting effect. That's why we're seeing what we're seeing with adjusting to neutral. We adjust someone, like I gave you the example yesterday, that little girl who had the nystagmus, I adjusted her, boom, it went. I saw her a month ago, 2 years later, and no nystagmus, no joint problem. It's functioning perfectly with one adjustment, okay? I'm not saying I'm a hero. I would love to be able to say I'm a hero. I would love it, but I'm not. It's the honest truth, okay? It's something that anybody can do, and all of you can do. Okay, it's just the technique itself. Okay. When we drive the joint in this direction, it's because we're so precise with the stretch being directed into the slow twitch muscles that we can have a long duration of effect. If it stops contracting, it stops inhibiting the other side, which was traumatized, and it can start to switch back on again. Now, there are other things we can do that can help to drive those muscles as well if we need more balance, and I'll show you some of those little tips and tricks today. But that's the key of what we're doing with this adjusting, okay? Is that we're first focusing on this tonic system, failures in the tonic system, resolving those failures, rebuilding those maps in the brain, creating greater afferentation, because anytime the joint becomes lateralized or flexed, okay, we're getting less afferentation. And as soon as it leaves that closed pack position, again, closed pack position is maximal afferentation. You leave that closed pack position for a period of time, the longer you're there, the less that joint is generating power. You have less energy coming from that joint. And the more subluxations you have, the lesser you're sort of charging your system. And you see old people, they're all like this, and they're all flexed, and they're all sort of broken and haven't actually been fixed. So the whole course of their lives are slowly degenerating and getting like this. And how happy and joyful and how activated are their cortices? How capable are they of expressing their greatest self? Not, they're like, get my way, my seat. They're like grumpy old people, right? Get off my lawn. That whole thing. They're grumpy because their cortex doesn't work. And you switch it back on and they turn back into bright, beautiful people. Okay. So we know this is the magic of chiropractic. This is what we're here to do. Okay. And we see these cases, we have these things, but it kind of feels like we're a little bit back and forth with some of the techniques we've been using. And it's not necessarily, I'm not trying to be critical of other techniques, but I think that we need to evolve our technique with our evolution of our understanding of the nervous system. And, we're really blessed in this age to know what we know about the system, whereby we can actually start putting it into practice. So I think there's an incredible future for chiropractic, incredible future when we start to use these principles and to discover new ways of approaching our patients and creating long-term change. So anyway, that's my first blurb. Okay. I like to monologue sometimes, so that's my monologue. Do you have a question, Jennifer?
No, sorry, I'm
Okay.
just waving my hands around.
Okay, that's okay. I wave my hands too. So yeah.
Can you just explain again how a fast stretch and a slow twitch muscle has a lasting effect again?
Yep. I don't know. It's in the books. I don't know. You mean how it does or
Yeah,
why
you
it does?
said when you adjust that
Yep.
it has a lasting effect, like you don't have to keep going in there and doing it again.
Yeah.
Can you just explain again how that works?
Yeah. The inverse myotactic reflex, I've looked at it many, many times and tried to figure it out, and I haven't found enough information about it to really understand why the slow twitch muscles have that lasting effect.
It just does.
I don't know.
Okay.
It just does. But yeah, I don't know the exact mechanism of that. Jake, do you have any idea? No?
Is it easier to elicit it because the muscles are weaker?
Well, it's actually usually easier to elicit it when, well, it depends. If you're going in with a high force, if the muscle is tight, then you're going to get an inverse myotactic reflex. So it's like some people are like, oh, you have to relax. You don't have to relax. If it's tight, boom, you blast it and it's going to go. Okay. But if someone is weak, what is it telling you about the state of their system? So we have to look at different types of weaknesses. So one is, put it this way, the way we generally think of and test weakness is actually a comment on your tonic system. So you say, hold your arm here. So am I testing? And you push down, right? You apply a force, sort of an increasing force, and you decrease your force. You're like, force. What kind of sensor is sensing that? And what type of muscle fiber is responding to that? Is it more of a tonic system function or more of a phasic system function? It's more of a tonic system function. Exactly. So it's like we think of muscle strength as a holding capacity, which is accurate. I think it's good. It's a good way to do it. Okay. So we're all testing the tonic system all the time. Okay. And we can do something. We can do things. You could put tape on someone. You could adjust them. You could stretch something that's going to change that tonic system. But the more we understand what we're doing, the more we'll understand what the kind of longevity of that effect is. Like if we adjust them and we need it again 2 days later to maintain that strength, then we have to say, well, did we actually fix it, or would it just have some effect, short-term effect on the system, right? So when you have muscles that are tight, we'll put it this way. So what we didn't talk about, and I'll just review very quickly, is that when you have a failure in the tonic system, your body doesn't like it because it's going to mean that that capacity to hold the joint is not going to be there. So your body will sense that it moves more than it should because those muscles aren't slowing that movement down. So what you'll do is you'll create compensation, which is usually to recruit other muscles or muscle fibers. And once you start recruiting the phasic system, those muscles that should be moving you, okay, then you start to encounter all the things that bring people into your office. My muscles are tight, my shoulders are tight, you know. Oh, my erector spinae are tight. Oh, my back is so stiff. Okay, it's stiff because your phasic muscles are designed to move you, not to hold you. So if they have to hold you and move you at the same time, they don't do it very well. Okay, they're pretty crap at it. Okay, pretty crap at holding and moving. Yep.
How do you view someone if they're kind of hyper reflexive? So you're testing their, tendon reflexes and they're, very brisk. Is that just as bad as being inversely myotactic?
So there's lots of ways of interpreting that. So basically what we're saying is you're creating a stretch and you're getting a stronger response. So let's just look at it in terms of the way we're looking at it this weekend. What would you say about the gain of that muscle? So if you tap it and you get a stronger response than you'd expect, you say the gain of that muscle is higher.
Yeah.
Okay. So why is that? Then you just have to start asking the questions and drill down. Okay. So hyperreflexia is just too much gain on the system. Why is your body responding like that?
Yeah.
Okay. It probably thinks that you're unstable. Okay. Oh, I need to really tighten up. You might be a little bit more sympathetically driven as well. Okay. So if your sympathetics are up, you're going to have hyperreflexia. Okay. So like one of the things that we often see, and it's a really quick story how to explain how the sympathetics affect things like this, is that we have to think of everything we're doing, and there's a plan in your brain to do something, and then your brain keeps a little copy of that plan. It'd be great if you talk about this later. Maybe I'll let you talk about e-parent copy and stuff, yeah? But basically, every time you're moving, there's a plan of that movement, and then when you make the movement, your body senses that movement and says, is it actually what I told you to do? And if it is, then you're great. If it isn't, your body goes into a bit of a panic mode, and you go, ah, and you activate the sympathetic system. So Jake's really good at explaining this, so I'll let him do it later. But what ends up happening is anytime you have a disafferentation, okay, in other words, disafferentation means it's a different sensation than what you're expecting. Okay, so if you're getting, and you also call that proprioceptive errors, they're cousins of each other, right? So if you have a disafferentation that's not quite what you expected, then your body's going to sense something's not quite right, and it's going to go into a little bit of a panic mode, and it stimulates your sympathetic system because you're like, I don't want to go down, I don't want to fall, I didn't move quite the way I thought I was, and it's going to activate your sympathetic system. What does it do? Boom, dilates your pupils because you're like, you need to see your environment really well right now. Boom, your peripheral vision becomes switched on. You're like, whoa, okay, now I see where I am. What does it do to your reflexes and your muscles? It activates them. It starts to get everything ready to contract. You're like, you tighten everything up because that's going to be more protective. Okay, so there's many more things, and Jake can explain. But anytime we have this, the body moving in a way it's not supposed to move, it's going to activate your sympathetic system. Okay. Okay.
I can see why. So we're sort of introducing a failure in the tonic system by adjusting them on the contralateral side, and I see how that's helpful to the issue at hand. But how is that not causing its own issue on the ipsilateral side if it's weeks to months to fix what you've just imparted?
Sorry, say again. So
by kind of quick stretching the muscles, the tonic muscles on the side, it's not the issue.
Yeah.
You're helping the side that's the issue in that moment. But if you're causing a weeks to month failure on the interspinal muscles on that the left hand side, let's say.
Yeah. Oh, I see what you're saying.
What then?
Yeah. So what we're doing is we're modulating that tone. So there's a difference between taking the joint. So in other words, we have one muscle that's a certain amount of tension.
Yeah.
Okay, a certain amount of activation, say a certain length.
Yeah.
Let's look at it this way. This muscle is a certain shortness, and it's too short. This muscle is too long. When we take it from this position and we stretch it, if we were to stretch it all the way, take it all the way to the end range, and then drive, we're resetting that muscle to that length.
Right.
If we take it from this position to this position, we're resetting it to this length. So this tight muscle is now reset to that length. And that should be the appropriate length.
So it'll say fail at the right length.
It's not failing. It's
Or-
you're inciting an inverse myotactic reflex. The inverse myotactic reflex isn't a muscle failure. It's a resetting of the muscle length. Or resetting the muscle reactivity is the best way of putting it. So we're changing the gain on the muscle. Okay? So anytime you incite the inverse, like a myotactic reflex, doesn't change the gain. After you tap on someone's tendon, the muscle is going to stay the same degree of activity. Okay? The same gain on the muscle doesn't modulate the gain at all.
Yeah.
Okay? The inverse myotactic reflex, what's actually happening, the way we explain it and understanding this, is that it's going to change the gain of the muscle. So the muscle, instead of being tight, is now, or what even in, say in a trauma, you have a normal length, normal tone, okay, normal gain muscle, and you throw the head forward like this when you hit the tree, and now that gain has been modulated. It's been decreased, okay? So now the gain on the fast twitch muscles and the slow twitch muscles is decreased.
Yeah.
So what that means is the gain is telling us how accurately it's responding to the signals to make it contract. So pre-treatment, if the brain says, give me 5 kilos of force to the slow twitch, to the slow twitch muscles, it'll give 5 kilos. If it says contract with this degree of force and acceleration to the fast twitch muscles, it'll do exactly that. Once you have a trauma, what will happen is you've reset the gain, and now that muscle is less reactive to that same signal. Your brain is going to tell it, contract with 5 kilos of force, give me 5 kilos of holding capacity, and the tonic muscle will go, I can't do it. I've been reset. Call me in a few weeks or a few months, and maybe I can do something about it. Okay? But it takes that period of time before it can actually start to respond appropriately again. Okay? So that gain has been modulated through that myotactic reflex on that particular muscle. Okay? And the same thing with the fast twitch muscles. Your brain is going to send a signal and say, I want you to contract with a certain degree of force to create an acceleration of this joint. And immediately after the trauma, it won't be able to do it. So after whiplash, someone's like all loosey-goosey, they feel fine. But then the next day, or after a few hours, those fast twitch muscles will recover. And every time they try to accelerate their joint, they can. But because the slow twitch muscles are not able to do that for weeks or months more, what's going to happen is these muscles are going to contract and the joint will move, but you're not going to be moving with the right activation of those muscles. And where those slow twitch muscles are very important is when you're now moving in that direction that you were traumatized, they should be able to switch on and hold you. But if they can't, every time you're moving into that trauma vector, you don't have the stability in that joint anymore. Okay, so your body senses that because it says, okay, move this way, and I'm expecting to get a feedback that you only moved as much as I said. Because there's no stability in that joint, the head moves a little further than it should. It's a small amount, we don't even know it. Okay, it's not something we're perceiving, but our body goes, whoa, that didn't feel right, and then it's going to start firing off those extrinsic or phasic or fast twitch muscles to try to hold the joint. And like we said before, fast twitch muscles are not good at holding. They're good at accelerating, contracting, relaxing. Okay, doing that kind of work. Okay, not holding. So if we ask a fast twitch muscle to hold all the time, they fatigue quite quickly. Okay, and when they fatigue, they start to be uncomfortable. They run out of metabolic capacity, and then you're like, oh, my shoulder feels so tired all the time. I can't hold my head up because you're using those muscles to hold your head. You're using those muscles for the holding and for moving, for everything you're doing. If you're a roofer or a builder or something, you're having to lift things up and you can't activate. You don't have any stability in your joint, and these muscles are doing double duty for you, they're going to fatigue really quickly. Okay? So we can look at all of the case studies of all the joint problems in the world, okay? And we start looking at it in terms of what's happening in the tonics and phasics, you're going to see again and again and again, what's happening in that joint is probably that the tonic system is failing, okay? And you have overactivation of the phasic system. One simple clue to that is just lay them down. If you lay them down and the tension's still there, the phasic system does not respond to gravity. Okay? the tonic system does. So when you lay down, all the tonic fibers should be decreasing in tone. You should see muscles that were holding you up before all soft and buttery. If you're not moving, your phasic system should be switched off when you're laying down. So again, muscles should be soft and buttery. But if you lay someone down and they have tension somewhere, that's probably the phasic or fast twitch muscle fibers continuing to contract because that system's been engaged, that protective mechanism's been engaged to try to make up for the loss of the tonic system. And it's just going to stay tight. It's going to be tight. Okay. So what do? Usually, what do we do with our therapies? We're like, okay, it's great. I have a Theragun, I have heat, I have massage, I have electrical stuff I can shock you with. It's all going to change the activity of those fast twitch muscles. And guess what's going to happen? You're going to have more mobility, but sorry, you might still be unstable. So go a little easy for a while, right? Probably good advice, because unless we're actually understanding that tonic system and how to modulate the control and activation of that system, then we're probably going to continue to have failures. Why does it happen that we can adjust someone's neck and then their knee starts working again and all the muscles around their knees start to relax? We should see that. I see that every day. Okay, someone has knee problems, popliteus tension, rectus femoris, whatever. Okay, soleus tension. You see all this stuff, you adjust their neck, guess what happens? Well, you put their whole tonic system back online. Wherever there's been an imbalance, you clear that noise and those errors. Now their system is more integrated and has a greater sense of where gravity is, and your body's capacity to activate that vestibulospinal control to turn on that tonic system, to turn on those slow twitch muscles in your spine through the medial vestibulospinal pathway, and to the lateral vestibulospinal pathway to all the tonic muscles in your extremities, switches back on. You put the whole thing back online, everybody goes, oh wait, I've got tonic control now. I don't need to have these phasic muscles tight anymore. And they melt. Okay? We've all seen it. You know, we're right on the cusp of it, you know? We're able to do it, but some of the techniques aren't able to create the lasting effect. The afferentation is part of it. Absolutely. So whenever we're adjusting a joint, we're creating afferentation. Okay? But the quality of that afferentation, the quality of control of that joint is what's going to allow it to preserve and continue to function. Okay? So that's where being precise with our treatments is really good. Yeah.
So just one point, if people are overstretch the muscle, if you think something's been there, let's say it was a significant harm that's been saying that prepped on for a long time. So I think well, probably said this yesterday, but two ways to change spine, things happen really, really quickly or things happen really slowly. So I could either whip back my neck and I've had a problem, or I could sit behind a computer for like 40 years and just slowly like collapse down. So probably because of our techniques, it's completely reasonable. You might not take a muscle from here to perfect in one go, right? So you might see it's a little bit better, a little bit better, a little bit better. But you still have, you know, we're not expecting everyone else like one-shotting every problem forever. Really recently, you might do a little bit, a little bit, a little bit. So every time you should see when you do diagnostics work better than it was previously. The patient, you know, so I'm not as good as Russ, obviously, so you'll see like a C2, you're like, oh, it's way better next time, but it's still C2. It's still that same segment, but it's just better, better, better until you get to the point where you go, and now it's done. Cool. And that will come, that you will genuinely be able to say, like, your neck is great.
Yeah.
It tends to be the ones that I find tend to come back is like the ribs and the thoracic, because people collapse down into that position again.
It's hard. I think people need a little bit of help to really activate that system and get it engaged better. But you know, we're learning and growing. You know, we might find there's some technique we could do that like fixes ribs forever. We don't know. But yeah, it happens. Yeah, Andrew.
What's your take on the fascial system in relation to the tonic system?
Oh, excuse me. Sorry.
What's your take on the fascial system
Yeah.
in relation to the tonic system?
Yeah. So I think there's probably receptors in our tissue, in the fascia, that are feeding that system and telling us where the load is. But I don't think that the fascia is a problem, because fascia is passive. So we have sensors all throughout our system. So I'm giving the example of our otolith, of our GTOs, and of our Ruffini endings in the joints, just to simplify the system, okay? But our nervous system is much more complex than I'm telling you right now, okay? And far more complex than I even understand. What I can tell you is there's many receptors that are classed as tonic receptors that are all feeding into the system. So it's not just those three inputs. We'll have receptors in the fascia. We'll have receptors in the skin. We'll have receptors in the gut. that are all giving tonic inputs. There's a lot of them in the gut as well. So you know where you are in relation to gravity because of your gut. You feel it in your gut. So there are receptors everywhere. And I think that your body is using all of those receptors, but the systems themselves are not entirely active systems. So the fascial system is like a little messenger system. Okay, it ties a lot of things together. Okay, almost in a kind of a loose ligamentous sort of way. But also, I think the stretches on that system are giving feedback to our brain. So I think from a feedback perspective, absolutely. From the fascia is the problem perspective, not really. When people are doing fascial releases, what are they doing? Slow stretches. What are slow stretches affecting? Muscles. Okay, it's affecting the tonic system. You're modulating the tonic system. So, like Jake was just saying, we create changes by things that are very fast and very slow. Do you know why? Tonic bias, exactly. So things that are very, very fast will elicit an inverse myotactic reflex and create a rapid modulation in the system. Okay, rapid change in the system. Okay, through the mechanisms we described this morning. When you do something very, very slow, you're creating a dominance of afferentation through slow to stretch receptors, slow stretch receptors, load receptors. So that's nuclear chain fibers and your GTOs. When you have a tonically biased therapy, your tonic system can be modulated. So things like yoga and slow stretches, you can modulate the tonic system. It's good. It works. It's valid, and it's working along the same lines that we're talking about. What about everything in the middle? Well, everything in the middle. Are you still getting tonic afferentation? Absolutely. But now you're getting phasic on top of it as well. So you're getting all of your phasic inputs about the acceleration of your body at the same time. So you're getting all that too. Okay? So if we want to focus the body on something, if you go very, very slow, if you go so slow that you can't feel yourself moving, okay, then that's a very tonically biased motion. Okay? Even things that are like Tai Chi, where you're moving very slowly. And in Tai Chi, do you accelerate like this? Is Tai Chi like that? No, Tai Chi is a velocity. It's very, very slow motion, right? When you're going in a velocity and there's not very much acceleration, so acceleration is like this, okay? Velocity is like this. It's like a robot, right? When you're moving very slowly, you decrease the phasic inputs, okay? Less phasic inputs, more tonic awareness. And when you're doing these types of motions, what you're doing is you're helping your brain to remap all of those areas, okay? So if you remap those areas, and the reason that they do these types of motions in Tai Chi is to allow your body to feel how you can move in different ways and still feel balanced. Why? Because if you build those maps well enough, whenever you need to do that fast, your body knows exactly how to do it. Okay? So Tai Chi, most people probably know, is a martial art, and it's for fighting. Every one of those motions are fighting motions. So you want to be able to strike something, and you're practicing this slowly so that when you need to do it fast, your body knows exactly where to put your hand without losing your stability. Right? You know that? Yeah. So
Yeah, I was just going to say, so in which case, then preventing fall, we know, is a big topic in later life.
Yeah.
I mean, I do recommend Tai Chi.
Yeah.
But now you've actually given me a much better understanding as to why it doesn't work so well.
Yeah, and it's also like, where do you start? Do you start with Tai Chi, or do you start with adjusting their joints and assessing their system? So we're going to start by assessing the system. We're going to start by looking at their eyes, where there's a breakdown in their motion. Can your cortex, like, there's probably some proprioceptive errors, like everybody's got something. How capable is your brain of getting beyond that? Look at their eye motion. How smooth is that, right? You see a breakdown? It's a sensitive test. It's not specific, but it's sensitive. And you start to dig in with your time zeros and your VOR and your P1 test, and it will lead you to the joint that's creating the greatest proprioceptive error. Okay? So the P1 test is something I made up. It's not something that's like in the books yet, but it's just kind of a cool way to figure that out. Okay? So that's how the tonic system works. That's why we want tonic bias therapies, is because that's how we create long-term and lasting changes. So the more we're thinking along these lines, and after we do the lumbar adjusting, Jake's going to take us through, a lot of the testing that we do, neurologic testing, and explain it in terms of what's happening in atomic and phasic systems. Okay? Any questions on that so far before we get into lumbars? Everyone get it? Got it? It's fun stuff, right? This should be chiropractic 101. Like that lecture should have been the first hour of your chiropractic training, in my opinion, right?
Yeah, exactly.
Yeah.
You know, if you went into chiropractic school and you're like, wow, that's what I'm doing? Whoo! Like my hair stands on. I'm thinking about it. I'm like, yes, I'm in. Count me in. Let's do it. Let's go. Where do we start? Right? And then everything you learn from that point makes sense. You have like an architecture to hang everything off of, you know? Information is just information unless you have something that has meaning behind it.